Hi, everyone. Welcome to our Big Unlock podcast. My name is Ritu M. Oberoi, and I'm the host of the Big Unlock podcast and managing partner here at Big Rio and Demo Consulting. And today we have with us Dr. Chethan Sathya from Northwell Health. And we're really, happy to have him as our guest and look forward to a very engaging and interesting discussion. We'll start with introductions. So I'll give it over to you, Rohit, and then I'll request Chethan to do his introduction. And a very warm welcome to all our listeners as well. Thank you for listening and thank you for being part of the Big Unlock podcast.
Yeah, thank you, Ritu. Hi, Chetan. Great to have you on the podcast. I'm the co-host of the podcast, also the CEO and managing partner at Big Rio and Demo Consulting. So we are kicking off the new year with the meeting with you. So I'm sure it's going to turn out a wonderful new year and wishing all our participants and listeners a happy new year as well. And looking forward to the interaction. So back to you.
Awesome. Yeah, thank you both for having me on. It's really, I'm excited to chat with you. So Chethan Sathya, I'm a pediatric surgeon at Northwell Health, so specialize largely in surgery for babies and children. And I also lead a number of our public health initiatives, including being the director of our Center for Gun Violence Prevention, which we will talk about a little bit as well. And kind of a third hat I have is my research is really focused on implementation science. So how do we think about implementing new things in health systems? And in that light, I've been working extensively with health tech companies, startups, emerging technologies to understand where we can implement those within the Northwell Health system. And how can you think about implementing technology with a real viewpoint towards clinician usability? How do you overcome barriers? How do you think about scaling those efforts, right? Because I've seen far too many technologies um, being built, even currently, that are really not made for clinicians. And I'm not surprised when they fail to scale or to integrate within clinical practices. So just a few different things I've been able to be doing here at Northwell.
Thank you, Dr. Satya, for that introduction. And, when I'm going through your bio, it's such an interesting mix of, how you came into this. And it's so amazing to see that you have a degree in journalism as well. So, we would love to hear your origin story and understand from you how you've managed to kind of combine all these different interests, healthcare and journalism and technology and bring it all to fruition. So I think our listeners would be very interested to hear a little bit more about that. Thank you.
Absolutely. So I was born in Canada. Both my parents are South Asian from Bangalore, and they're both physicians as well. One of them trained in Bangalore, and the other one actually did medical school in Canada. And, growing up, that was, of course, a very formative experience for me. Being exposed to the healthcare setting, what doctors do. There wasn't really another option for me, career-wise, other than being a doctor, which many Indian kids, kind of
Yeah.
back and reflect on. But I was really thankful for those experiences because I was able to then go to medical school and really fall in love with surgery, and particularly pediatric surgery, which is what I ended up going into. I did my undergraduate degree in McGill in Montreal, then medical school residency in Toronto, and then was fortunate to go to Northwestern in Chicago for pediatric surgery fellowship, and then came here to Northwell in New York about 5 years ago to practice as a pediatric surgeon. And yeah, I never really thought that I would be focusing on larger issues like public health or, as you mentioned, storytelling and journalism. We'll talk about that in a second. But really, at that time, my core was to be a pediatric surgeon. And I love the idea of being able to work with parents, kids, being able to do these operations, these complex operations on babies, and to be able to really take that child through to adulthood was incredibly rewarding, and it's something I focused on during because you asked a question about journalism, during my time doing my research work in Toronto, my master's in clinical epidemiology, I realized that as a researcher, we were so fixated on publishing, you know, but all too often our work wasn't reaching the lay public. It wasn't reaching lawmakers. It wasn't actually resulting in policy change or the correct type of advocacy. And so I wanted to learn how to speak to the lay public, how to storytell. And so I was fortunate there to undertake some journalism training in Toronto, become a journalist, freelance for CNN, CBC, BBC, write for the Washington Post, and so on. And that was actually a very incredible experience for me because that has shaped how I integrate storytelling into a lot of the current work that I do, and really taught me the appreciation for how you take your work and translate that to the larger public, right? Because that's what it's about. How do you get what
Right.
we know out there? How do you educate folks and how do you enact them to create change? And so
Mhm.
that's what led me, kind of combined everything, got to Northwell 5 years ago and since that time have learned a lot.
Mhm. So tell us a little bit about your work with gun violence. How did you get into that? And, what are your thoughts about that? And especially, I mean, just looking at your, LinkedIn and reading about pediatric gun violence, I mean, just looking at that makes you feel so scared as a parent and as a person. So what are your thoughts on that? And, you must have seen things which are like
Hmm.
indelible from your memory. So how do you like deal with that?
Yeah, I think it's interesting. I never thought that taking on a public health issue like gun violence would be a focus of my career.
Mm-hmm.
That really wasn't part of the plan. When I trained in Chicago as a pediatric surgery trainee, one of my formative experiences, unfortunately dealing with this, was my first week on the job there. I had to treat a 6-month-old baby with a bullet wound. And I still remember that baby coming in, being shot while sitting in a car seat in the back of a car. I
Crazy.
remember, yeah, my fingers on the bullet wounds there, the parents' expressions, and this baby's life just slipping away. And that experience, yeah, really did stick with me. I always had a desire for larger, opportunities to create change, work on public health policy. I'd been doing that a little bit prior to that experience, but again, hadn't focused solely on gun violence. But that really took it to the next level for me. That child did survive, by the way, but remains paralyzed to this date because that bullet actually hit her spinal cord.
Yeah.
Um, but it wasn't the last time. Week after week, I kept seeing kids with gunshot injuries in Chicago and here in New York. We're the
Mhm.
largest level one peds trauma center here in New York. We see a number of kids with those gunshot injuries, and so I had to say, listen, like, this has to be not only a focus of what I do, but how can we work with health systems to get things done? And I was really fortunate that when I got to Northwell in the end of 2019, that our CEO decided serendipitously to
Mhm.
take a stance on this issue. He was one of the first health system CEOs to do that. Many of us on the front lines have cared about it, but we rarely have C-suite executives want to do that.
Mhm.
And so that right place, right time lined up, gave
Mhm.
me an opportunity to work on this topic, to work with our then CEO, Michael Dowling, and we continue to work with our current CEO, John D'Angelo, on this. But to build a center, build a coalition nationally, do research on the subject, implement protocols, work with lawmakers across the country on this topic, and the rest is history.
Amazing. Rohit, would you like to ask a question?
Yeah, nothing would be complete, Chetan, in today's day and age without touching upon AI, right?
Mm.
So, so would love to get your thoughts. A lot of us are using it, personally in our lives, and many large healthcare institutions have adopted it across the board. So, what are some of your thoughts around generally new technologies? And what have you seen change like in the so many years that you've been in healthcare? What are some of the changes that you're seeing coming along with new technologies? And where do you see it all going in the future?
Yeah, it's so interesting because I think pre-COVID, we always used to talk about the fact that nothing has really changed in the last 100 years between the way that I see a patient in my clinic. Not much had really changed. Of course, technological advancements have been incredible. There's been incredible scientific advancements, medical advancements, but that actual interaction with a patient, you having to go into emergency department, having to wait to see a specialist, having to get tests, having to see me in an office, hadn't fundamentally changed. I think, COVID, obviously, we talk about how COVID-19 really did accelerate a lot of that innovation in healthcare, allowed us to use telehealth in a very different way, to innovate without the same regulatory requirements. And I think that did move us forward. Now, post-COVID, I think the concern there is that we hit some level of stagnation. When I think about telehealth, I think there's so much more that we could do, for example, but I now see a shift away from telehealth in some of the things we're doing because we haven't really gone past just seeing someone on a screen, right? We're not actually changing fundamentally how that interaction is. But to your point, with the advent of AI and other technologies, I think in the last 2 years I've seen a lot of things change. Whether it be ambient listening, whether it be billing optimization, whether it be diagnostic co-pilots, open
Mhm.
evidence some of these new, LLMs that can really help us answer things. I think it's been great, and I think we're only scratching the surface. There's a common kind of discussion in a lot of medical forums about how, hey, listen, but we have to make sure physicians are in the loop and AI can't take over everything. I agree with that. At the same time, I think even more so that AI is actually better than us as physicians on a lot of things, right? There's no possible way that humans, any human, physician or non-physician, can digest the amount of evidence out there and actually know what the latest is with respect to every single guideline, right?
Mhm.
So if you can have a computer and an algorithm help you do that, it would be a disservice not to use that for our patients. So I think we need to embrace it even more. We need to cut down the regulation around using it, not be as afraid. And of course, we have to have certain boundaries and safeties in place. But no, I'm very optimistic.
That's great to know. So, how do you, Chetan, blend it in either at Northwell or any of the other work that you're doing with other healthcare organizations in this, initiative that you have around gun violence? How you are seeing any new innovative approaches or any, strategic differentiations taking place?
Yeah. So I think, to differentiate the two, on the gun violence public health side,
Yeah.
there's a whole bucket of innovation that's happening around improving the way that we surveil public health issues. Like, how do we get data about what's happening in this country, whether it
Mm,
be a new virus like the next COVID, whether it be
mm,
gun violence, whether it be opioids, whether it be access to healthcare or maternal mortality? There's a significant need for more innovation in the space of public health. And we've definitely seen an uptick in some companies doing that, right? Innovator's been focused on this from a value-based care standpoint, doing more in the public health space. I'm seeing a lot of innovations with HIEs or health information exchanges and how they talk about data, how health systems come together and surveil these things. And so there's a lot of work there we've done. We've also leveraged AI to have predictive analytics as to, can we predict who might be at risk of being shot? For example, in the gun violence space, and can we offer life-saving interventions before that gunshot happens? We know there are interventions that help. For example, safely storing a firearm, having gun locks on it saves lives. Being able to deploy what we call violence
mm,
interventions to youth who are at risk of being in gangs and cycles of violence help save lives. But how do we
mm,
deploy it in the right way? So I think we've been working on that standpoint from a tech atmosphere. But then more
Right.
broadly, on the Northwell side, I mean, there's on the health system side, I mean, there's just so many different things going on, right? Ambient has been a big one.
yeah.
Um, One of the other companies I'm very close to and doing work with, Savaro, which is a telestroke company. They're really
Mm,
focused on improving access to specialty care across rural communities and across other specialties. I think that's a huge area of need. You're seeing CMS and the government invest a lot of money into that right now.
great.
So that's another area, right? Patient access is probably a one of our biggest priorities.
That's awesome. That's awesome.
Yeah. So I think that leads into a good question, that you've seen multiple waves of digital health and AI enthusiasm coming in. But from your vantage point, what is the difference between AI initiatives that actually scale and which are those which quietly, stall or die down after pilots? Like, what would you think, can you give us an example of like a successful project that you've seen, go to scale versus something that stalled after a pilot?
Yes, yes. Well, far too many examples of stalling.
Mm-hmm.
I would say the majority of solutions, this is obvious, but the point-based solutions
Mm-hmm.
just are difficult, right? Like I always think about this from a workflow standpoint as a clinician. This is on the implementation usability side. In
Yeah.
order for me to use something or for a physician to use something, we make the mistake, I think, sometimes in the assumption that the overriding decision for that use is better outcomes. It's
Okay.
not. Actually often saving you time and being easy to use,
Mm-hmm.
right? Because I think a lot of these technologies, it's very difficult to show that outcomes are that much better than the current standard of care, right? And people, so that can sometimes be a difficult argument. But my point is that physicians, healthcare workers have a lot on their plates right now. And anything that cuts down on that and seamlessly integrates into their workflows really works. And again, that sounds common sense, but
Yeah.
so many of the technological solutions I've seen are an extra, an extra download. They're not integrated the right way. They actually add more time to what I'm doing than
Right.
helping.
Mm-hmm.
Uh, so ambient's a good example, right? I think the ambient solutions out there are starting to make a big difference. Before, even with the Dragon, let's say, I can type faster sometimes than I can speak if I have to open a new app, take a device out, carry it with me and do that, right? So those all things have to be kind of taken into consideration. So the like ambient, I think, is succeeding right now because it's integrated into a lot of our workflows. It's easy to use.
Mm-hmm.
It's replacing our medical scribes that we like quite a bit. And so solutions like that, I think, really work.
Hmm. So what would you say is one key point that healthcare leaders, generally underestimate when it comes to clinician adoption? Like one thing you mentioned was that if anything is going to add like an extra layer or make it more harder for you, then you're not, going to adopt it. But what are some other than ambient? Have you seen this happening with like voice agents or, some of the other newer technologies that are coming in that you feel can really like transform the patient experience as well? And on the other side, make it, easier for clinicians to adopt as well.
Yeah, I think the agentic, opportunities are huge. Whether you're talking about administrative agentics at, scheduling,
Mm-hmm.
uh, nurse triage.
Mm-hmm.
If you think about it right now, even like our call centers, the way that we answer calls from patients, it usually goes through a call center, then whoever's on call has to answer that call.
Right.
You know, there's tremendous opportunity in that
Mm-hmm.
space. And I think you will get adoption there because it goes back to making the lives of those who are doing the work easier, right?
Yes.
My life would then become easier.
Mm-hmm.
And not in a selfish way, I just mean in a practical way. Then you can do more patient care. You can spend more time with a patient. You're not inundated with these random calls. So anything in those spaces, yeah, I think there's a lot of opportunity
Mm-hmm.
um, there. Uh, Again, I'm coming at this from the lens of an academic clinician. I think when
Mm-hmm.
you're more in private practice, I do see a lot of adoption of things that are more driven towards the incentives there, right? Rev cycle, billing optimization.
Yeah.
Uh, those are all big.
Mm-hmm.
Maybe not so much the academic side, but I think you always need to think about what is the incentive for a clinician and
Mm-hmm.
how can you align with what their needs are in order to get them to adopt something.
Cool. So we've been, we have an arm of a venture studio, and one of our most recent incubies is like this company called My Eyes AI, where we're
Hmm.
looking to democratize, ophthalmology and bring it especially to rural areas where, there might not be enough ophthalmologists out there. So we would be really keen to, get your insights on that and talk to you about that because you mentioned your connection with Savaro. So that would be
Yes.
really interesting as well.
Yeah, it's just amazing how many millions of Americans don't have access to, yes, primary care, but even
Mhm.
more don't have access to specialty care.
Right.
And, with the overwhelming amount of new evidence that's coming out, new procedures, there's no way primary care doctors in rural communities can offer all that.
Mhm.
And so they need help. And I think that's wonderful. Yeah, I'd love to learn more.
Yeah. So are you looking at any particular specialties right now, like to start with, or what's the?
So on the Savaro side, um, I'll just speak about that, right? Not the Northwell side, but I know that there's a strong interest to expand to certain specialties that health systems have pain points with, meaning, they don't have enough supply for the demand
Exactly. Hmm.
or they're high acuity. So cardiology for sure, maternal fetal medicine, critical
Okay.
care,
Okay.
dermatology, and
Hmm.
gastroenterology tend to be high
Perfect.
um, on those lists of
Yeah.
specialties.
Made a note of those.
Yeah. And then ophthalmology is always a high one. Absolutely. I mean, eye care is a big thing.
That's
What
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 we've been hearing about. Yeah.
that's
So the
wonderful.
time's flown by, I think, and we're almost at like closing thoughts right now. It's incredible how fast this goes. But
Yeah.
Dr. Chetan would love to hear your thoughts about maybe, looking out over the next 12 to 18 months. What are your feelings or predictions about, what's going to happen with AI? What would your bets be in the specific field of like AI, or, equally, what would be something to avoid, according to you?
Yeah, so specific to, let me just make a quick comment on the public health side too. I think
Sure.
just for listeners, I think there's a lot of reasons to be optimistic. There's a lot of innovation happening in the public health space, even what CMS, the current government's doing.
Hmm.
Um, there's a lot happening there, and so I tell people about that because it's easy to sometimes to feel like things are being torn down, and they are in different areas. But I think there's a lot of innovation happening in public health, and I think I would encourage folks to look out there, particularly as it relates to rural health, just like what we were talking. And I think for AI, I mean, I think this is, yeah, I mean, I think 2025 is just scratching the surface. I think this is the year, you already brought it up, Ritu, but I was going to say like where agentic AI does take off in real life,
Hmm.
for our practices. It hasn't yet, it hasn't permeated in our day to day. But I really think given how everything's lining up, it will this year. And I think that will significantly enhance our jobs and then lead to the workforce disruptions that we
Yes.
expect. And we're going to have to adapt. And I think that's something all organizations are thinking about. Because you need good people and that is a major, major concern. But how do we train those folks for that next phase? I think that's what this year is going to be about.
Great. Any closing thoughts, Rohit?
I think it's a great, conversation, Chetan. Super exciting how you're blending the worlds together.
Yes.
Got to learn more, so definitely stay in touch and looking forward to to the next interaction, perhaps.
Awesome. Yeah.
Okay.
Thank you so much for having me on. Of
Thank
Yeah,
you.
thanks for
Thank you for
taking.
being on our podcast. Take care.
course. Of
Bye.
course.
Bye.
Thanks.
Thank you.